My cousin has breast cancer. She's breastfeeding. Can treatment be given while breastfeeding?
Now, there are two ways to look at this question. Number one, the lady has already been diagnosed with breast cancer during the pregnancy. Or number two, she notices a lump in the breast while breastfeeding. In the former situation, challenge lies in the treatment decisions, while in the latter, the diagnosis itself becomes a challenge. Now, why so? Because, for one, it is extremely rare to develop a breast cancer during lactation because the very hormones that are feeding the breast cancer cells are at the lowest during the pregnancy and lactation. Moreover, even for a seasoned oncologist, it is a difficult scenario to diagnose because the breast in general is thick and engorged so that the diagnosis might be missed upon. Also, imaging like mammogram and ultrasound might give inconclusive reports. Most of the time, a lump in a lactating breast is either a breast engorgement or a collection of the milk because of one of the ducts getting plugged or blocked by the thickened milk itself, or a mastitis or inflammation in and around the collection, which if infected may become an abscess. Sometimes it could be just a harmless cyst or a dilatation of the duct filled with milk or a galactocoele. Most of these conditions can be treated conservatively and completely. When a lump is persistent, not responding to treatment, or is growing in size, or is fixed to the surrounding areas and is accompanied with dimpling or puckering of the overlying skin, one should raise the bar of suspicion. But please do not wait for these things to happen and get yourselves checked if you come across anything suspicious while lactating. Can a woman breastfeed if she has breast cancer? Usually, we recommend that a woman stops breastfeeding following a breast cancer diagnosis. This is because some treatments can affect a woman's milk supply or even negatively impact the baby. Treatment will vary depending upon the stage at diagnosis and other tumor characteristics. Surgery might be the most feasible option to remove a lump or a cancerous growth or the affected breast itself. The extent of the surgery will determine whether or not the individual can continue the breastfeeding. Chemotherapy or hormonal therapy can have drastic damaging effects on the baby, and when needed, the women will need to stop breastfeeding altogether. Some women undergoing radiation therapy treatment may be able to continue breastfeeding depending on the specific type of therapy. To summarize, breast cancer while breastfeeding is rare but not impossible. In the event of a diagnosis, the woman should discuss her options with the doctor, including whether or not she can continue to breastfeed.